I think we are preparing to live stream, so probably are live streaming.
Hello everyone, hi. We're here for another Holistic Vet Sisters and we've got a few questions that you've asked us that we're going to answer today. We're also here with another one of our Holistic Vet Sisters. So we're here with Birgitte from Denmark. I think you've been with us once before, haven't you?
Yes, I have. I have.
And some really exciting stories that you've got to share about some dogs that have recovered from some quite dramatic illnesses. So we're going to hear those as well. So I don't know how you guys want to start. How do you want to start today?
Birgitte, do you just want to briefly say who you are, or I can do it, but then you'll blush. Birgitte, let me just say, Birgitte is the vet in the veterinary acupuncture world. She's the president of the International Veterinary Acupuncture Society, IVAS. And very busy practicing acupuncture and teaching other vets how to practice acupuncture. So we're very honored whenever we have a precedent among us. We were just talking before we went live. You were beginning to tell us that you had a story about a cancer case, and then we said, no, don't tell it yet. Wait till we're live.
Yeah.
Go on.
It's so amazing. It's so amazing because, you know, I work with acupuncture and herbal medicine, and it's the primary thing that I do. I don't do normal conventional stuff. And I was treating this senior dog because she had some back problems, and I've been treating her every month for a couple of years, I think. And suddenly she came to me, and the owner was very sad, and she said she's got a very serious illness now. And I was sort of, what? Yeah, she started coughing. So I went to my normal vet, and she said there was something with the heart. So she went to the university to get a scan of the heart, and the veterinarian there, he said, but I don't think it's the problem, the heart that there is the problem. I think you should take an X-ray. And then they took an X-ray of her lungs, and she was filled with cancer in the lungs. She had some tumors in her udder that was removed 6 months earlier. But this was quite a surprise, and of course she was very sad about it. So but suddenly the back was not the main problem. Now it was the lungs. So I treated her with acupuncture, and I started her on some herbal medicine, and she came for a while, I think once a month or something like that. And shortly after the first visit at my clinic, the dog stopped coughing. And she's 13 years old, but you cannot see, she's a senior pup. She has so much energy, and she's running and playing, and nobody knows that she's that old. And then I listened to her lungs every time she came to the clinic, and I was sort of something wrong with my stethoscope, because I couldn't hear so much from the lungs, and she was just fine. So I think 3 months went by or something like that. And then the owner definitely wanted to go back to the university to have a new X-ray. And she went there, and they took a new X-ray, and there was nothing to see on the X-ray. And they didn't believe it. So fortunately, she had a small spondylosis. So they could see that on both pictures, because they were quite sure it couldn't be the same dog. But the very nice thing about it, besides that the dog is feeling so much better, is that the oncologist, she's really interested in it, and she has brought it forward to her colleagues. She's brought it to a yearly meeting for the oncologist, because she wants to sort of listen, there's something else that we can do instead of giving them chemo or doing nothing. So this is a very good story.
Yes, amazing.
I love that. That's incredible.
Lucky dog.
Yeah, lucky dog. And the owner, of course, she's so thrilled about it as well. So, and me too.
It makes waves. If it makes waves, this is what we're looking for, isn't it? For people to understand how important these can be.
Yeah, it's quite amazing. It's
Well
quite
done.
amazing.
And that's the sort of stuff that obviously is impossible because you've got a metastasized breast cancer. It doesn't go away, does it? But it does. That's amazing.
Yeah.
Fantastic. That will be an amazing step for, well, just health. If dogs that came to the university hospital were recommended acupuncture, wouldn't it? Or just advised that they could seek acupuncture as a possible treatment.
Yeah, exactly.
Fantastic. And it's nice when you meet that true scientific approach, that someone sees something that they can't believe and then they want to talk about it and they want to investigate. Because sometimes you get well, I don't understand that. That clearly couldn't have happened. So there must have been a mistake somewhere and I don't want to talk to you.
Yeah.
So, which is like as far away from a rational scientific attitude that you can possibly get. So this is such a nice story.
Yeah.
Yeah. I like the word senior pup. I know a few of those, but I've not heard it expressed like that before.
Oh. I've got many of those.
Yeah.
Yeah.
And we started talking about cancer because there was we had a question from Karen. Have you got that there, Tina, or shall I try to remember from it? There was a very, very long question. It might be too long to read out, but it was Karen, who has a Nova Scotia Dog Tolling retriever called Purdy, who has written to us several times because when we had Reagan, I think from Scotland, was talking to us, I think that's when copper storage disease was mentioned, and Reagan was talking about that a little bit, and that's why Karen wrote to us, because her toller Purdy was diagnosed with copper storage disease. So I think it initially happened as a question about copper storage disease and genetic testing for copper storage disease, but just to make a very long story slightly less long, when she then wrote the whole story of the dog, I think it was a nice example of how when we talk about health holistically, it's never about the diagnosis, because what started out being a question about how to get genetic testing and whether or not genetic testing is available for tollers in terms of copper storage disease, when she then writes Purdy's story, Purdy is an 11-year-old toller, which is already quite impressive because they don't normally get very old, that has ulcerative, it's called CUPS, also canine ulcerative periodontal stomatitis or something like that, very painful ulcerative gum and teeth disease, which is supposed to be of a probably autoimmune origin, but also has metastasized cancer, had a sarcoma removed and now has abnormal liver and all sorts of different values. So all I'm really trying to say is partly I promised Karen that we would address this, and then it turned out to be a far, far, far bigger and longer story than just talking about copper storage disease. In fact, I would say in this case, probably the fact that Purdy has copper storage disease is hardly relevant, really. But it's a nice example of how you have to look at the whole case. And when you have a very, very elderly dog with genetic illnesses, cancer, it's not about treating the liver or any of those issues. So I think the best we can really say to Karen is absolutely find a holistic vet and let them take the whole story. And it can be somebody who works with homeopathy, it can be somebody who works with Western herbs, it can be somebody who works with acupuncture and Chinese herbs, but it's not about treating the liver or treating the cancer or treating the mouth ulcers. It's about looking at Purdy as a whole individual and helping her live her best life in this last phase of her life, as well as she can, which will absolutely be an individual prescription, and then or maybe an individual cocktail is the wrong word, but combination of treatments or remedies, but it has to be for her because she's obviously got some very heavy conditions, and they're all come together in one situation, and it's all depending on how her symptoms are and how her symptoms are showing. But as we've just heard an example of, even what sounds like very, very serious conditions can sometimes be treated with amazing results. But it's not going to be this is what we do for this case, or this is what we do for that case, and it very rarely is. But in this sort of situation with an older dog with several very serious diagnoses, it absolutely isn't. And I would think, you know, genetic testing for copper storage disease is neither here nor there, but looking at how to support her as an individual could make a lot of difference. Just because I promised Karen that we would address this, and it turned out to be a very complicated case. So there you are.
Comment on that?
Yeah.
Yeah, because sometimes with my experience, some of the patients that have so many diagnoses or a long history of different illnesses, and it can be, at first, it can be difficult to know where to start and how to solve everything. But actually, I learned once when I went to Canada to visit a very famous acupuncturist, a veterinarian called Steve Marston. And he had a client that came in and had all these different diseases. And I was sort of, Jesus, what is going to do about that? But he took it from the top, sort of, and looked at what is important to do right now. And when we talk traditional Chinese medicine, we use these metaphors like too much dampness, too much heat, too much cold. And if you sort of start with what is screaming most out from the animal, then you can, like you do with homeopathy, you take one a piece of the onion and go deeper and deeper and deeper. And it's just sometimes when we meet these difficult cases, people that are not, or veterinarians that are just starting to do acupuncture, they get afraid of how to treat these kind of animals. But it's much easier if you just think about what is the worst thing with this dog, and then we'll treat this. And next time something else has shown up. And then, like the story that you tell, there's so much going on. So perhaps just look at the dog and see what's the most obvious, what's the most important to do for the dog right now.
Yeah. I like this phrase that they say a lot in Chinese medicine, that you're peeling the onion, because like you start and then you find more layers and then there's more things, and then some things that are not obvious to begin with sometimes can show up later after you've removed some things that it becomes more obvious, which I think is just so obvious when you do like an acupuncture screening on a horse, for example. You start and the horse says ouch, 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 and then you put a couple of needles, and then maybe the next time you come back it just says ouch, ouch, ouch. And then next time maybe you only have like a few problems left, like eventually, which are like the deeper rooted problems that obviously takes a lot longer to treat. But yeah, this is also why I love this kind of medicine.
Yeah, I normally think of it as you know, sometimes if we have so many problems and so many different labels and diagnoses, the question I often ask is, what if we ask the dog, what bothers you the most right now? You know, what's the problem today? Is it I can't eat because I've got nausea, or is it I can't eat because my mouth sores hurt, or is it, you know, what is it that limits that individual's quality of life today? And then that's the top layer, and then we address that, and then we can go deeper and deeper and deeper. But it's certainly never, you know, conditions like this and heavy cases like this and chronic disease like this, the treatment will never be dictated by the diagnosis.
Exactly.
That only happens if it's a very, very acute condition, or if it's an accident, or, you know, something, first aid, something that happened, something that happened to them.
Or if it's conventional medicine.
Oh yeah, absolutely. Yes. Absolutely.
All right. Should I move on to Hannah's question? She actually asked it a while ago, but I wanted Lise to be here. She's asking for advice about lepto vaccination. She's read a bit about nosodes and was wondering if going down this route would be an alternative to vaccinating. I know now they've removed the lepto 2 vaccine as well, so I think now only the lepto 4 is available.
Yeah, if that's for me, I mean, I think different people will definitely answer this question differently. So I'm just saying my personal opinion. I don't understand the frustration about the lepto 2 vaccine being discontinued. I know there are huge Facebook groups devoted to this issue about which lepto vaccine to give. And for me, that's just, I don't understand the problem. Personally, for my own dogs, but also as a veterinary surgeon, I am too scared of any lepto vaccine to want to give it to any dog. If I was in South America or somewhere where, you know, in the season where there was lepto everywhere and people were getting ill and dogs were getting ill, then I would probably feel different about it. But lepto vaccination is for conditions where there's an active epidemic and there's lots and lots of cases. And to my knowledge, that's not, I've never been to a country where that was the case. I mean, it exists, but I've not met it. Not in the UK and certainly not in Scandinavia. So you're always weighing up, what are you most afraid of, the disease or the vaccine? And for me, that's such an easy answer that I see a lot of problems following leptospirosis vaccination. I have yet to see a dog that's been, you know, died or been severely ill from leptospirosis. So I am very afraid of the vaccine, very unafraid of the disease. So I would just not vaccinate against leptospirosis, full stop. If you are in this, if the person that asks is in a situation where the neighbor's dogs have got, the neighbor's dog has lepto, and this is an infectious disease, what shall I do? Then I would say absolutely give the leptospirosis nosode. You can get it from a homeopathic pharmacy, and I would, in that situation, I would give it every day for weeks probably until I felt that the situation has gone away. The problem with nosodes, if you want to protect a dog forever, is that it's, I know Vicky, who's one of our regular sisters, feel differently, and she's quite happy to put dogs on. As if I remember correctly, what she was saying, that she's got dogs who take lepto nosode monthly or whatever. We can ask her again when she comes back. I am hesitant to do that because you would have to do that forever then, and there's no evidence that it works. I mean, we know that a nosode doesn't induce an antibody response, so. I can't imagine how you would keep someone protected the whole time. We also know that nosodes work really well when there are acute outbreaks. That's been shown before. It's been shown in leptospirosis in South America, Central America. It's been shown in kennel coughs, an outbreak like that's in kennels. But that's when you have a rampant infection during a limited time period. Then absolutely give it to everybody, give it daily, give it twice daily. But if you're talking about protecting someone for years against the disease that may not even be around, I don't think that's what nosodes do well. So I would just not vaccinate and worry about something else personally. And if you come across it, you know, if it's been diagnosed at the local vet clinic, if it's someone at the training grounds have it, then sure. I mean, give them the nosode for a little while, but I wouldn't do it as an ongoing lifestyle thing. I'm not good at short answers, but that would be my answer. What do you, Birgitte, what do you say about leptospirosis vaccination? Do you give it to your dogs?
No. And I'm exactly like you. Exactly. I'm more afraid of the vaccines or the chemicals than the disease. It's the same with the tick problem. I guess there was a question about that as well. And a question that is always asked in the clinic, what kind of stuff do you use? And I say, I use those two. But we talked about it last time, I think.
But let's talk about it again, because we get asked about ticks all the time, and it's the season where everyone starts asking about ticks.
Yeah.
One question at a time, guys.
Okay.
Okay, yeah, and also I just wanted to mention, you know, obviously the vaccine of lepto is also not 100%.
Oh no, absolutely.
Yeah, and we don't really know how long it lasts, but it's vaccinated for yearly, and again, we don't know exactly.
And that's the problem with that disease. You know, the disease exists, and we'd rather not catch lepto, but it is in Northern Europe a very, very rare disease, very, very rare disease. And the vaccine exists, but it's not a very safe vaccine, and it's not a very effective vaccine. There are so many different forms of leptospirosis, and the vaccine covers, depending on which one you use, 2 or 3 or 4 of them. And there is no cross protection. So you're just as likely to catch lepto, pretty much, even if you are vaccinated. So it's a false sense of security. It's mostly, I think, for the owner's peace of mind rather than actual protection. And thankfully, it's a disease that's so rare that I wouldn't worry about not having protection. And we mustn't forget that more people come down with leptospirosis than dogs. But we're not being vaccinated because there isn't a safe and effective vaccine, and it's not that big a problem. So we should start with ourselves, really.
One question about the nosode. So if anyone wonders, where can I get nosodes? Is there a bad nosode or some place that it doesn't work, or can you get any nosode for lepto? Or?
That's a really good question, and I'm not quite. Nosodes, technically speaking, are homeopathic. Sorry about this. I don't know how loud it is in your ears. It's very loud in mine. Nosodes in technically are homeopathic medicines made from diseased material. So a leptospirosis nosode would actually have to be made from some tissue or something that was taken from a dog that was infected with leptospirosis. Sometimes we confuse them with tautodes, which are homeopathic medicines made from medicines, including vaccines. And I'm not totally sure if you went to, I mean, the big homeopathic pharmacies to get remedies from in the UK would be Ainsworth's or Helios or Nelson's. And I'm sure they would all have a leptospirosis nosode available if you contacted them and asked them. But whether it would actually be made, or whether it would be a real nosode, or whether it would actually be a tautode, I don't know. They're used a little bit randomly. Sometimes people mix them together. Sometimes they have it from one vaccine batch, sometimes from another, and sometimes from actual disease matter. And I'm not sure if it would make a difference really either in real life. But I never use the leptospirosis nosode, to be honest. I could imagine using the leptospirosis tautode if it was a matter of someone having been hurt or injured or damaged by the leptospirosis vaccine, but then I tend to use the homeopathic remedy Thuio instead because it's so effective in those cases. And all I can say is I spend a lot of time treating dogs that suffer the ill effects of leptospirosis vaccine, and I have yet to see a dog that suffers ill effects of a leptospirosis infection. So yeah, I don't think it's a disease where nosodes are that helpful, except maybe for peace of mind, but then that's maybe a little bit silly. Yeah.
Okay. And we had a bit of a bigger question from Fiona. She said her dog has a very stubbornly high ALT, which is a liver enzyme that you can check on blood testing. She said all other values are okay. Ultrasound showed nothing, no clinical symptom. On discussion with other vets, it seemed like the ALT being high in raw-fed dogs is very common. I have tried various natural liver support options. Any insights from you?
Well, this is true that it does seem to appear slightly higher in raw-fed dogs. And I think we have to ask ourselves, A, is that actually causing an issue? Is that genuinely a problem for the dog and their liver function? And we also have to ask ourselves, where and when were these values created? Were they created for processed food fed dogs, or again, processed food fed dogs? In which case, are they actually biologically sound values? You know, shouldn't we be reevaluating the values in respect of, are these actually causing a problem? And I think that's really where at the APNC we've got to with that. We do need to really consider the benchmark here, rather than, I mean, it's different if they are so high they're genuinely causing an issue, but for them to just consistently show this slightly higher value but not have any ailments, or, you know, not be compromised in any way, I don't think it's something we should necessarily be worried about. We should more be saying, hang on a minute, why are the values not being reconsidered now? At least 15% of the UK at least are feeding fresh food. You know, we need to be looking at that. I would look at it that way.
Does Fiona say what kind of dog or how old her dog is, or?
Yes, let me just find it. She said, yeah, it's a, let me see, I think it was 4 or 5, yeah, 5 years old, raw fed from about 5 months. I feed a mix of DIY with wild pheasant, deer, trout, rabbit, and yeah, some pre-made brands. I'm in the UK, feed Paleo Plays, Honeys, Betty's, Cotswold Raw, Mercy Raw, and some others.
I wonder if this is Fiona who comes to the Natural Dog Expo, because I have a funny feeling that we answered this question at the first expo from the stage. Lise, you would have been
Oh,
there.
don't ask me about things that even yesterday, let alone 3 years ago.
I'm pretty sure we
Have
did.
we met?
That was the catalyst for Katie from the APNC to look into it. So I don't know, but I think maybe. But that's funny that people called Fiona ask the same question. So
it's an interesting, I mean, Birgitte, what would you say to a clinically healthy dog that has high ALT? I mean,
yeah, I have seen it as well with these high numbers, and I really like your comments, Caroline, that maybe we should look at the values, and perhaps they should have another area where it's normal and not normal. But I don't, if it's the only value that is increased, I would think of perhaps giving it some herbal medicine just to support the liver.
She
And
did.
it's not that I expect there is a lot of different things going on with the liver, but just to support it, but just for a short while.
She
To-
did.
to-
She used a lot of different herbs throughout the years, and nothing really changed it much.
I
Okay.
think it's the values. I think we do need to reevaluate them, just like the guidelines for pet food. You know, they're just not that appropriate for a fresh food diet.
Yeah. And I mean, Anna Heilman would be the person to help with these and to know exactly about ALT. The one that I see consistently raised in raw fed dogs is urea, and I just don't worry about that really. But the problem with this is that if it hasn't raised ALT, and it has had raised ALT for a while, it could be that it's just an anomaly and it doesn't matter and it's related to the diet, but it could also be signed. I mean, ALT is very unspecific. It just means liver damage. It could be infection or inflammation, or we don't know what it is. So we can't say definitely that, don't worry about it. At least if you wanted to do that, you'd have to take a liver biopsy first, which is a little bit invasive for a dog that feels fine. So it is a frustrating situation. Speaking about memories, I'm sure that I had a case in the last couple of years that had persistently high ALT levels and was fine, and I read up on it, and I spoke to some internal medicine specialist who said that this is actually, I'm almost sure that this is actually a described syndrome where some dogs, particularly small dogs, have high ALT and there's nothing wrong with them, and it's just how they are. But like I said, the problem is that you can't reach that conclusion without having excluded everything else. And there's quite a lot that you would need to exclude. So I think you would need to biopsy to be able to say that this is definitely nothing to worry about. I'll try to find that. I'll try to see if I can dig that out, because I remember reading up on it and finding that there were articles available describing almost certainly it was high ALT with nothing else showing up.
Yeah, it was quite high. I think it was between like 200 and 400.
Yeah, but we should still remember that when we are holistic vets, we don't take just one number and look at that and say, oh, then we are going to do this and this and this. We need to look at the whole animal. That's why we are here. So, I mean, if I found symptoms on the dog like some acupuncture points which were relevant for liver issues or something else, I would put the story all together, and then I will know what to do. But I will definitely, I like to have the blood samples as well, because you can always have them as a support, as one of the factors in the whole picture. So I agree that we should not ignore it and think that, but there are so many things going on with these blood samples, and I really like your comments as well, Caroline, because there's a lot we don't know, like with the food, there's a lot we don't know about which vitamins and which minerals do they really need, actually. But that's another question.
No, but it's a good point also that sometimes you can treat holistically without having an exact diagnosis or an exact explanation, because you look at symptoms in a different way. So you can analyze it using, you know, a Chinese analysis, or you can look at it in terms of homeopathic remedy pictures, but you can get to a prescription because it fits the patient, and then the raised liver enzymes is just the starting point. It's what made you look at the individual, but once you look at the individual, you'll see a pattern that you can then treat, even if you can't put a clinical name to the disease that you may or may not be treating. So that's a good point.
I would very much like to have this dog into my clinic, actually, just look at it and see, like, is there, like, in TCVM, can I see anything with the liver? Like, is there something else going on? Peeling the onion, just see if it would have an effect. Obviously, there can be, you know, so many reasons for this. But I think, yeah, like Birgitte said, like treating it as a whole patient, looking at environmental toxin exposures. I have had some interesting cases of where the dog comes in with really high ALT, and then the owner's just been in the hospital for hepatitis. And then I'm just wondering, what have they both been exposed to? Is there anything in the environment that could be like because the thing is, you can't supplement your way out of like a really high exposure to something, for example. So if there is something in the environment as well that is causing it, it doesn't matter how much milk thistle you will take, they will still keep accumulating and struggling, even if you sometimes give it a bit of help. Then if the whatever is causing it is not removed, then it's very hard to treat your way out of in that sense.
But I also think as well, the tail end of that question is that the vet is blaming the raw. So it's like, okay, well, so what would the guardian like? Would the guardian like to switch, but she just wants to know that actually the dog's liver enzymes might change, because they might not if there's a genuine issue. But the alternative feeding regimes are going to cause other issues. So you kind of like, where do you go with that? You know, you either have to just say, okay, cool, thank you for your opinion, I'm going to get another opinion, or a few other holistic vet opinions, which is obviously what's happening now, really. But yeah, it's what do you do with that? You know, sometimes you do just have to stand and say, okay, the vet thinks it's that, but there's nothing else going on, so we're going to keep going with it with this diet. You know, I mean, maybe there is some tweaks to the diet as well. And I was also thinking environmental, because you just don't know. There could be a particular pesticide that's used in that particular area. You know, some counties have different pesticides than others. So you just don't know, do you, until you delve deeper.
Yeah.
But it could also be the other way around in terms of diet. It could, I mean, because the temptation could also be to say, oh, well, she's fed raw and we're quite happy continuing to feed raw, but that's probably the reason. I mean, diet may be a red herring in this context. They may have absolutely nothing to do with diet. Exactly. Not all dogs fed raw have raised ALTs, for sure. So
it's quite common though. It is quite common to have them slightly raised.
This was more than slightly raised though, wasn't it?
It was quite high.
They were, yeah.
Yeah, I don't see that as a general thing, but I would certainly say.
Oh no, we've seen them. That's what made Katie look into it.
Anyway. I think I would probably say you can't blame it on the diet, but you also can't just dismiss it and just put it down to the diet. I would see a holistic vet, I think, and try to take the dog's case in a different way to see if you can support the whole animal.
From what she wrote, obviously I can't see if it's complete, like balanced and so on, but it looks like a really good diet, and she's rotating a lot, which is really good. So I think if there was like one thing, if she fed like one commercial diet the whole time, then maybe if there was one tweak or one kind of misalignment in that diet, then obviously the risk goes up. But since she's feeding such a variety of things as well, I quite doubt it. But one thing I think would be minimally invasive that could be looked into would be to do a hair mineral analysis. I'm just wondering, of course. Because like I'm wondering if there could be,
we're
like,
all going to have to do this soon. Don't we?
oh yeah, it is so interesting. And it like I just got my map back from my hair mineral analysis, and it literally like sums up everything that's wrong with me and everything that's wrong with my diet. And it's amazing. And it's like you can see, you know, levels of heavy metals and stuff as well, and mineral levels so much better than you could in any blood test. So it's a really good tool. So it's a little pricey depending on where you live, but it could be one like non-invasive step to start taking. You know, is there super high in one of the heavy metals or something like that? Okay, what around me could have those things? What can I eliminate?
Yeah.
Just like one one additional tool. Especially in the UK now, you've been spraying stuff all over the sky.
Yeah, we have. Yeah. Well, I haven't, obviously.
Mm.
Wishing to wake up and not see it.
Literally.
And
Yeah, should I go on to the next question?
Yeah, go on.
Yeah. So yeah, Alison also had 2 questions actually. So I work with my dogs in the moors and wondered if you can suggest anything to carry when it comes to adder bites. That's the first one. And the second one is about ticks.
start with the adders. Do you have adders in Denmark?
Yeah, and it's a problem, and it's a problem at this time of year. I mean, it's potentially fatal. I mean, it's very nasty and it's very painful in humans as well, and for small dogs particularly. It can be very bad news. There is a homeopathic remedy that I hand out when people ask, that can be helpful in the acute phase. Is the remedy apis, which is actually made from bee sting. So it's for that immediate reaction to things that bite or sting you. But I hand it out hesitantly, and I give the advice hesitantly because it really needs to be followed by, it's not instead of going to the vet. I mean, if your dog is bitten by an adder, you head for the nearest veterinary clinic, but you can give them apis in the car on the way there. And you know, I mean, at this time of year, if you're in an area with adders, I would sort of have the vet's phone number with you. You know, I mean, it is something that needs immediate action, and you need to go to a vet straight away. You can't wait to see if they're okay, because if they're not okay, I mean, I maybe sound overly dramatic, but I don't want to give anyone the impression that you know, just take this natural remedy and they'll be fine. I think if there is an adder bite, you go to a vet immediately. But there is, if I was to suggest something to take on the way to the vet, it would be the homeopathic remedy apis for adder bites.
I can add some conventional thoughts to it as well. I think in most countries they're more aggressive in early spring and the summer, which is like a period where you should be extra cautious on maybe not letting them loose, or
which is now.
Yes, which is right now, to be careful. And if it is to happen, you want to like carry your dog, try to not make the venom spread, and just get to the vet as soon as possible. Think of anything else.
So is there like an anti-venom thing? Because we have these. We used to take them in Cyprus, because obviously they've got more snakes there, worse snakes in a way. And when we went on our rambles, our sort of organized rambles, the sort of team rambler, team leader, if you like, would have this, you know, in case somebody nobody ever did, but you know, so I'm sure that's what people mean, isn't it? Should they be taking that with them?
Oh, well.
Oh no,
you can
no. Okay.
You can get it in the hospital, but it's very expensive. And at least where I worked, we would only give it if the case was very severe or something the owner specifically requested.
Yeah, that's useful for people to know that, because they may think that they're missing out in their dog first aid pack.
And wasn't it back in the days, maybe you guys can tell me, I think they used to give out steroids before, just like in case they got bit by a snake, you can give a steroid tablet.
That still happens, I think. Yeah. I mean, and I think if you rush your dog to the vets, they'll give them steroids in that situation.
Which is really only helpful if they're about to get anaphylaxis and like they're allergic to it, isn't it?
Sure, but I mean, I don't know enough about it, but I think that's not an uncommon reaction. I don't think if you have a bite like that, you can. I've also heard people recommend just antihistamines, but I mean, all these things are on the way to the vet. They're not instead of going to the vet. They're what may help you to keep your dog alive as you get there. Yeah, but and like Tina said, prevention. You know, if you're walking in areas where there's loads of adders, just stay to the paths and keep your dog on a lead and be aware of, you know, the times that they're out and the weather conditions that they're out.
Exactly, especially this time of year. Do you have anything to add, Birgitte?
No, not really. Not really. The only thing I was thinking about is that there was a guy who called me Monday morning, and he said he had been to Sweden all weekend hunting, and Friday the dog was bitten by a adder, and but now it was fine. So, but the difficulty is that they sometimes have several of 100 kilometers to the nearest vet in Sweden. So when they're out in the forest and they're hunting, and then suddenly this happened, it's difficult for them to go anywhere, and it would take like 3, 4, 5 hours. So this particular guy, he just waited, and then he called me Monday morning, said, "Is there anything I have to do?" Not really. He was sort of feeling well, so. But
it's a bit hard to think of something that they could do in the moment if they don't have. I mean, I can't even think of something that they would. Well, they could give antihistamines if they had them on them, or they could give steroids if they had them on them. But yeah. Or they could give a homeopathic APIS if they had. I mean, there's no reason not to, but I would still aim for the vets. And most of them are fine, especially bigger dogs, but some of them are not.
And then the following question is always a big question at this time of year. Any suggestion for preventatives when it comes to ticks?
What do you say, Birgitte?
Yeah. I mean, there are so many natural remedies that you can use, but I'm not sure about the efficacy of it, because they have different kind of colors with the raw,
amber
with amber, and some people think that they are very useful and some don't, and different kinds of oils that you can use. So, but again, I'm more afraid of the chemicals than the ticks. And of course, I know that some dogs, they get very ill, but no, I really don't know what to say about that.
I think people sort of look it up, don't they? And then they think, are they missing something? Because these natural alternatives aren't just excellent. They think, well, I can't have got the one that works, so there must be something else, So it just gets asked all the time. But I totally agree that we need to minimize the chemical use, if use it at all. So we don't really have a choice but to try everything. So Fusa does have an amber collar. To be honest, we don't go places where there's ticks, and if she does pick a tick, I just take it off. It just comes up. I mean, I think we have to really think about how many of these actually carry disease and how many of them are going to give the disease, and in relation to the damage that the chemicals could do. Again, it's the weighing out all the time, and I guess it depends what you're comfortable with doing. You could try all the things that you find online that help, that are natural, but they're not necessarily going to be the ultimate key. So it's just trying to find as many different ones that are suitable without overloading the dog, of course. The ones that work. And there are loads of different oils, aren't there? Like neem oil, you can use that on its own. Even things like lavender is being talked about now as like, the others didn't work, so we'll even go there, kind of thing. So and some dogs and some cats just do not get them. So for instance, my partner's mum has got 2 kittens, so they're the same age, came from the same litter. One of them ticks all the time. The other one never gets ticks, and they go to the same place, they sleep in the same place. They just are so different, obviously, internally. Their chemical composition, their microbiome, their frequency, their energy must be so different, even though they're actually from the same litter, same age, eat the same thing, and do the same things, live in the same place. And they get both. Well, the one that gets ticks is it's not just sheep ticks, it's deer ticks as well, which are littler, aren't they? So they're even more frustrating to take off a wiggly kitten. So I just think sometimes it is down to the dog as well. And how can we maybe cleanse the dog in a better way, perhaps, and detox and methylate the dog a bit better?
Go on, Tina. No, sorry, go on.
No, I was just going to start a rant of, how I live in like the Midland, Norway, and like here in the clinic, every single owner is like, okay, this time of year, where's my tick and flea prescription? And it's like, I live in an area where we don't have that many ticks, and we don't really see any tick-borne illness where I live. And that's when I'm like, is it really needed? You know, I think is a common misconception, because tick in itself is not dangerous unless you live like in Australia where they have paralysis tick or something like that. It's the diseases that they carry. So it depends a lot on where you live. But I think the core thing to also know about ticks is that it's not like it attaches and gets the disease right away. You know, like for most of them, it takes a variety of different hours. Anaplasma is quite fast, but some of them take up to like 24, 48 hours before they transmit the disease. So if there is not that many of them, especially if you're a little dog, light color, you can see things pretty well, you know, you brush off them a bit after they've been outside, and then you remove the tick quite soon, the risk of getting disease is actually really low. So I think that's something important to keep in mind. And then repellents obviously doesn't kill ticks, but it can make it less likely for them to attach. Try to avoid high grass, stuff like this, things you can do in your own yard. I also have a good one that I really like that I want to do in the future as well is if you have like chicken or something like this around your home, they can actually eat around guinea fowls as well. They eat a lot of ticks. They can remove a lot of ticks from like your local area as well. So there's many like small little things you can do to kind of repel or decrease the risk of them catching them. And then obviously, yeah.
So we should be going back to this symbiotic farming, you know, where we had these poultry around the sheep. We didn't separate everything and only have sheep. You know?
No, absolutely. And the environment is really important. I mean, I think that's the thing to look at rather than say what to do against ticks, because some dogs never get ticks, and it varies. Was it a hard, cold winter? Was it a very dry summer? Where do you live? How does your garden face? How do you cut your lawn? Where do your dogs go? In a lot of situations, it is possible to just manage the environment and the dog's movement and exposure to the environment so to minimize the ticks. You know, maybe you walk on the beach in the summer and you save the forests and the shrubbery and the meadows for winter when there aren't going to be any ticks there. They are in high, tall grasses and busheries and shrubberies and things like that. They're not on the path. They're not on the beach. Typically, they're not on a lawn that is cut really, really short. Maybe if you fence in part of your garden, or, you know, there's lots of things you can do that can just limit the exposure to ticks. And I know tiny little dogs that live their life in bags, hardly ever set foot on the ground, that get Bravecto every 3 months. And it's just crazy. There needs to be some balance in this. I would, as a first step, I would not do anything at all. But then if you have a dog, and it's also like Tina said, if you have a small dog with light skin, short fur, it's in your hand, it's, you're touching it and examining it easily every day, I would just remove a tick whenever I see it. If you have 10 St. Bernards, then that's more difficult. And then maybe you have to rethink that and use something else. The only thing that I would say is I would never, ever use the antiparasitic drugs that need to be ingested. I would not eat poison. So I'm not going to give, I was struggling to find a different word, but it's poison and I wouldn't eat it. And if I'm not going to eat it, I'm also not prepared to give it to my dogs. I would never, ever recommend those products that they need to eat. I do sometimes recommend products like colors or products that, the drops in the neck. If a dog gets lots and lots of ticks and it's not realistic to stay on top of them, then that's what I would do. I'm not a fan of all the smelly so-called natural products for various reasons. The biggest one being that they don't go with homeopathy. They will antidote homeopathy. They can also in themselves be irritants. They can cause allergies. They can irritate mucous membranes. I wouldn't put neem oil or tea tree oil or something like that. It can be an irritant and you can get allergic reactions to that. But I also just can't help thinking that dogs that think of their sense of smell. It's how they experience the world. They, when they go for a walk, it's all smells. And if they're doused in lavender or neem or it must be like going out in the world blindfolded. It can't be a nice experience for a dog.
I have thought this before about, I think with some of them, they are more subtle, or they're hydrosols, or it's the energy of the herb that's actually doing the repelling anyway. So it's more the flow of it. So yeah, I think there's an argument for using them in the right way, but definitely I think sometimes we can just go overboard with these things.
But there is also an argument, and that doesn't matter whether we're talking about smelly, washes or oils, or whether we're talking about amber colors, or whether we're talking about Bravecto. Some of it works. Like, remember that old dad joke about a man going around like this because he's keeping away the elephants, and they're saying, but there's no elephants here. And he says, no, see how amazingly it works. It's so effective. And there just isn't. I'm sorry, I know it's weird, but there is an element of that. You do something and the problem, and you just assume that this is because they had a Bravecto. You never occurred to you just to not give it and see how many fleas they actually get. And if it works by this method and it's not harmful, then there's no harm done. But I wouldn't give the poisons that the dogs need to eat. They are far too many side effects associated with them, and there are actually other products that are more effective with fewer side effects.
And now that I have your attention, oh, sorry.
I just want to mention that I think it's very important when you have dogs that are chronically ill, suffering from allergy or IBD or some other chronic diseases. It's so important that they don't use those kind of chemicals. But I feel that many people, they don't think that way. They just think it's so important that he doesn't get ill from something that the tick is carrying. Instead of thinking how bad it is for the ill dog, actually.
Yeah, to eat poison on a regular basis.
Yeah.
And one thing that I wanted to mention now that I have your attention as well is the effect on the environment. Like, these chemicals are everywhere. They've tested it all around the lakes of the UK. They found it in every bird's nest. It is actually like increasing mortality rates in birds. It's killing our marine life. It is killing off insects, and it's making our bees confused so they can't pollinate. Like, we're just looking into the future. This is very scary. Also seeing how a lot of these drugs, that a lot of these parasites find resistance towards some of these drugs now. So just imagine, like, 50 years from now, we won't have food on the table, we can't have clean drinking water, and there's no antiparasitics that works anymore. This is a very scary thought, in my opinion. So if you need to use these products, make sure that if you put it as a spot on, first, if you take a tablet, keep them indoors, always pick up the poop. If you take a spot on, please don't use it in swimming seasons, or don't take them swimming in natural lakes, at least up to a week, preferably more, because there could still be remnants in their coats. So these things are really important to try to prevent the spread of chemicals into our environment as well.
And it's not actually just a holistic point of view anymore. I mean, we talked about this a couple of months ago. I can't remember quite when. There was an article that just came out that demonstrated exactly what Tina was talking about, and the president of the British Veterinary Association was saying we can't keep using these blanket preventatives, and they're not. Preventatives is also a weird word, because they're treatments. You're treating someone who doesn't have a problem. It's not the same as prevention. But she was saying we have to stop using these flea and tick products to everybody as a general recommendation. It's dangerous.
Can I take up one more topic?
Well, we only have 5 minutes. I wondered whether Birgitte could tell us more, because she's here with us just today. So maybe something exciting. I mean, you've told us about the cancer case, of course, but
yeah. Oh, I'm just so happy for my needles. And I so very often see cases that you would never think of going to an acupuncturist, because my experience is that people, they think of acupuncture for pain. So something that is hurting in the dog, like a sore back or whatever. But time to time, I see these chronic diseases like heart problems. And recently I'm treating a Cavalier King Charles Spaniels, and he's only 3 years old, and he of course has some problems with his heart. And then we just started to give him acupuncture, and it's quite amazing how well he works, because he has so much more energy and he's playing much more. And you can sort of say it's not something that you can measure, but still the owner really feels that we are doing something good for her dog, and the dog is actually doing better. And I know I cannot make him well, and I cannot mend the heart, but I can give him a good life as long as he's here. So I think it's important to think about that acupuncture is not only for pain. Acupuncture is also for internal medicine and problems that are different. So it's so wonderful to work with behavioral problems or epilepsy or infectious diseases in the gut, and I can keep on. So I'm so happy for my needles, my acupuncture needles.
Yeah, you told us about an incontinent case too, didn't you?
Yeah, that's true. That's true. She's really doing well as well. And it's a 10-year-old spayed, quite large dog that's been suffering from incontinence for 6 months or something like that. And we started with herbal medicine and some acupuncture, and then she proceeded with the herbal medicine, and it worked very well. And then suddenly it didn't work that well, but she hadn't had any acupuncture treatments for a while, only the herbal medicine. But then she came back for the acupuncture needles, and then she's dry again. So that's quite amazing. And that's something that the owners really can measure, because they can see there's no pee. So that's really nice for them. So yeah, but I mean, there's a reason why acupuncture has existed for thousands of years.
It is one of the modalities that's got the most research, I think, as well.
Yeah, I think so too.
Mm.
Even though it's difficult to make groups where these control groups where you don't treat them, because people or animals know whether they're treated or not. So then they do sham acupuncture, which have some kind of efficacy, but not as much as if you use the right acupuncture points.
There are a lot of acupuncturists in the UK, veterinary acupuncturists, that are just dealing with pain. And I think, as we've talked about before, that they do a different course. They don't learn.
They do, yeah. They do a different course.
The Western acupuncture course.
Yeah.
And I mean, that's cool in a way. If you've got a dog, you know, I looked into it for mine, but really, you want to be finding a TCM acupuncture. There is an Acupuncture UK website that has I think that website has all the different schools on it, so, and all the different practitioners in the UK anyway.
Yeah, but there's also, you can find them on IVA's website, can't you?
Yes,
Can you find all the schools or just that one practice?
You can find the members, the veterinarians that have been educated under IVAS. You can find them on the web page.
Yeah.
So
Either that or Chi University.
Yes, we've said these before. I think there's some good vet acupuncturists over here that aren't in either of those two, but they're still really good at what they do. So I don't know where they're listed. It must just be on the vet. You know, I think I can't remember it, but it'd be something. They're all letters, aren't they? So it'd be like
sure. Yeah.
vet or something, or, you know, acupuncture something vet.com or something like that.
yeah.
But it is exciting when you've been in clinical practice practicing conventional medicine, and you just know when you see these chronically ill patients, you know that they're never going to get better, and then you suddenly have a tool where they get better. Yeah. And it's like I just completely resonate with Birgitte's, you know, it's just like that's not supposed to happen. That's impossible. You know, and that's every day. It's just hard not to get excited, isn't it?
Yes, exactly.
When things go away that you just know were not supposed to go away, you know, that's not what normally happens. And sometimes I'm more excited than the owner, because they just kind of think, well, I came to you to make it go away and you made it go away. I paid you money. I kind of expected it. And I'm sitting there going, but you don't realize this is impossible.
Yeah. Can I share one thing before we end this session? I just wanted to tell everyone that is watching this that I'm working on a course, mostly for owners, but also for any professional that wants to be able to know what direction to send their clients when it comes to picking the right commercial dog food. I haven't found a lot of good courses out there that focuses on what to look for. So I made a really comprehensive course, and I'm gonna make it very quite cheap and available to everyone, so that everyone can take a look at the bag and actually know what they're giving their dog, because there's so many fancy pictures and they use so many marketing terms and they don't even list the carbohydrates on the package. They need to calculate it. They make it so difficult to look at the right food. So I made a comprehensive course because I feel like everyone buys commercial food at some point. So that will be coming up very soon.
You can put a link under this video.
When it's done, yeah.
Yeah. Okay. We are out of time. So all that remains is to say thank you to Birgitte. And when we go offline, we can talk to you about when you can come back and join us again. Thank you. Thank you, everybody. And see you next week.
Okay.
No, hang on. I have to remember how to do it every time.
We're still here.
I know. I'm just trying to end the live stream without